just about kind of who we are and what we're doing, and like you said, the data collection that we are hoping to achieve from this evaluation. So the content of the slides, we will go through a brief introduction. Iram will then discuss the process evaluation activities that we'll be conducting, and then we'll discuss the impact evaluation activities before mentioning value for money and next steps for the new year. So, as I'm sure you're all aware, DFT have funded 12 transport pilot schemes that aim to tackle loneliness amongst different groups of individuals. And NatSem and RSM UK together are conducting an independent evaluation of the Tackling Loneliness with Transport Pilot Fund. So you've got me from NatSem side, and Iram is from the RSM side. So there are 3 strands to the evaluation. We have a process evaluation, impact evaluation, and a value for money strand. So I suppose really briefly, the process evaluation aims to understand the content of the programmes, the how, when, why they're delivered, and then what different groups of individuals think of the programme. And the impact evaluation focuses more about kind of cause and effect. So we'll be asking questions of a causal nature to try and understand any kind of pros and cons and outcomes of the programme, and whether the programme caused these outcomes. So I'll hand over to Iram for the process evaluation.
Great, thanks Kitty. So there are 3 elements to this. We've got a number of interviews that we'll carry out. We will have 2 pause and reflect points, and we also have the common minimum data set, so the monitoring data. So in terms of the interviews, what we're hoping to do is involve pilot staff in discussions with us at 2 points across next year. The first point will start in January. I know that we had hoped to do that sooner, but just for a number of reasons, I think January is the earliest that we're going to be able to do that. And then we will probably interview people again, if not by March, shortly after, because I know the pilots end at that point, but we want to make sure that we capture the entirety of any learnings as you've delivered and rolled out your activities. So we'll interview at least 2 members of staff at each of those 2 points across each of the pilots. And I think for CTA, it's going to be a little bit, as I'm sure everything is, a little bit more complicated and a bit different, because you're a pilot, but you have lots of sub-pilots within your pilot. So it's not as straightforward as saying, great, we're going to interview one central CTA person and then someone else who has oversight over one of the kind of key elements of one of the components, because you've got lots of different partners who are involved in delivering all of the pilots. So we still need to discuss with DFT how we do that, but it might be that we speak to 1 central CTA member of staff and then we speak to 3 pilot staff, and so that would mean maximum we can include is 3 pilots out of the total number that you have. But we don't yet know how we're going to cut that, so I'm afraid I can't tell you whether your particular pilot is going to be involved in these interviews or not, but we will be able to let you know by January when we start reaching out with those invites. So we expect those interviews will take around 45 to 60 minutes, and we want to cover a number of things. The experience of applying for funding, so that might be CTA's experience of the funding application with DFT, but that might also be the pilot's experience of applying for funding to CTA. We're also interested in your experience of the monitoring system, so the CMD templates that we've sent out and how you've been able to actually capture the information and some of the potential challenges around that, and we may well get onto that later in this call as well. We're also interested in knowing about some of the facilitators and the barriers that helped deliver the pilot. What are the different roles of partnerships in delivery, and that includes working with other suppliers, charities, and any other organisations that you're working with to either identify or to provide services or interventions to your beneficiaries. We'd also like to know about any key lessons that you've learned around reaching service users versus whatever your original intentions were at the outset. And broadly any other key lessons that you've learned from delivering the pilot. And there'll be a different focus on different elements of those things that I've mentioned in the January interviews versus the ones that we'll do right at the end, where you should have completed the entirety of your activities and you may have more to say about the overall reach, for example, and to what extent you were able to achieve that. So that's the interviews. If we move on to the next slide, Kitty, we also have 2 pause and reflect points, and we're planning to have one again early next year, and the following one will probably be around March time. These are going to be thematic, so we will decide with DFT which are the particular themes that they're interested in. But a subset of pilots will attend based on the theme and its relevance to them. So if, for example, we wanted to have one entire theme on community transport, then that would likely be the most relevant to your pilots. And there are a number of other pilots across the 12 that also have a community transport element, and they would also join that, for example. And the purpose is to share learnings about what's working and not working, but also to highlight any key successes and reflect on learnings that we can then bring into the process evaluation in that thematic way. But there are a number of themes that we are discussing with DFT at the moment, but I'm pretty sure that there will be one on community transport because it is such a large theme. And then the final element that we have for the process evaluation is the common minimum data set. So you already have those templates, you've got the points at which those templates need to be completed and shared, and we will be analysing that data across all of the pilots and bringing that together and using that to lead some of the conversations in the interviews as well. So if we're seeing that you're reaching more or less beneficiaries, particular types of interventions are working better, etc., in terms of the reach, then we may pick up on that as part of the interviews as well. So that's the process evaluation. If we move on to the next slide, I think, Kitty, that takes us to the impact side of things.
Perfect. Yes, it does indeed. Great. So for the impact evaluation, we have decided with DFT that we will conduct this part of the evaluation on a subset of 7 pilots, one of which is the CTA. And for this strand of the evaluation, we will be collecting additional data. And again, kind of as Ira mentioned, the CTA is such a vast programme of pilots that we've decided that we will try to focus in on 2 pilots that have been funded by the CTA. And again, those are still being negotiated with DFT. So we will be conducting case studies of these 2 pilots, and they consist of up to 3 staff or volunteer interviews, and then up to 8 beneficiary interviews as well. So for these, we're really trying to almost have like a deeper dive of these pilots to understand how they were delivered, and similarly kind of, those outcome data. So what happened in terms of differences and changes in loneliness. We will also draw on beneficiary level data from the CMD. So that will be used to kind of inform the process evaluation, but also the impact evaluation as well. And then with the CTA, we will be looking at the anonymised baseline and follow-up survey data that's being collected, and that also includes kind of measures of loneliness that we can really dig into to see if there's been a kind of causal change on loneliness. So again, that was a whistle-stop tour of the evaluation, but Iram, if I hand back over to you for value for money.
Yeah, great. So for VFM, we aren't planning to look across all of the pilots, because I think the only thing that we could do if we did that was really come to some sort of cost per beneficiary metric, which isn't very meaningful because we know that all of the pilots are doing very, very different activities and very different lengths and intensities. So that's not going to give DFT a huge amount of learning. So what we've settled on is looking at 4 deep dives. into 4 pilots, and CTA will be one of those pilots. And we're going to take a social return on investment approach. And that's mainly driven by, so the 4 that we've selected, including CTA, that selection is mainly driven by the pilots that are collecting some level of outcome data, so where you've got survey data, but then that will be supplemented with these additional focus groups and interviews that we will do. So when you do a social return on investment approach, you're essentially taking a bit of an exploratory approach and you're trying to identify and come to a shared understanding of what some of the costs and the benefits were of a project in the round. And we're looking at things like the value of a reduction in loneliness, what was the value to individuals of having access to additional transport, what did it allow them to do, and what were some of the health and other well-being benefits that they experienced, and then monetizing those. So in order to do that, we'll conduct focus groups with beneficiaries. So for CTA, and again, I think we're only going to be able to do this with one of the pilots. So we're going to have to select which one of those pilots that will be. But for that pilot, there will be a focus group with 6 to 8 participants. So we will need the support of that pilot to help us identify who those individuals may be and provide contact details if they're willing to take part. And then we'll also conduct interviews with 4 of the service provider staff. So I think, again, that's going to be at that 1 pilot level, where you've had involvement in administering and delivering the services, to also get your inputs into some of those costs and the values that that you've observed. So that's a quick overview of the 3 different elements that we have within the evaluation. Kitty, I think we're probably moving on to next steps now.
Next step, yes. So you'll be pleased to know there's nothing for you to do on your side this side of Christmas. So in the new year, RSM will be in touch to arrange the grant holder interviews with 2 members of staff. Unfortunately, as Iram said, we're only able to speak to a couple of projects. So we're trying to explore a range of different activity types and kind of who target different groups across the whole DFT funded projects. So Iram's colleagues and RSM will be in touch in the new year for those. The next CMD return is the 13th of January. That's in line with your DFT financial returns, I believe. So we've tried to align those where possible. And then in the new year as well, we will hope to arrange the first pause and reflect session. And this will probably be once all grant holder interviews across the DFT programme have been completed. From the impact side, so from my side on NatSen, we'll be in touch separately in the new year to arrange the kind of the case study interviews, so those staff and volunteer interviews and the beneficiary interviews for the impact evaluation. So again, nothing for you to do on your side, but just to let you know, these are coming down the line from us in the new year. And if you do have any questions, whether they be specific questions or general questions, we do have a DFT loneliness email inbox at NatSen that goes to both myself and a couple of other members of the team. So if you do have any questions, please feel free to drop us an email. I appreciate that was a really whistle-stop tour. I think we've just been 10 minutes of the evaluation. I will stop sharing my screen, but if we have time for questions, Iram and I are both happy to take any now.
Thanks so much for that, guys. It's really informative. I mean, it's there's such a lot of information, and obviously, where we CTA are one part of the 12 organisations that you're working with, so we appreciate your time today to actually come and kind of chat to us. Oops, sorry, that's my Alexa chatting to me for some reason. There you go. So over to the groups. If there are any questions, I think we had a little bit of time here. I think there might be a hand or 2 up in the group there. Harry, do you want to jump in?
Yeah, sure. I was just wondering, what model do you use to actually evaluate loneliness?
So we did have quite a long scoping review session to kind of think about, potentially having a counterfactual or finding a control group so that we can measure loneliness. Unfortunately, because the project across the whole DFT portfolio is so varied, we are not able to do a kind of traditional, if you like, impact evaluation in that regard. So we'll be using a theory-based evaluation approach called contribution analysis. I don't know if you're familiar with it, Harry. I see you nodding there. So potentially, yeah, that's the one we're going with.
Okay, sorry, I've got another question as well. Sorry. Can I also ask, well, when was this evaluation process that you've just outlined? When was this actually established? Was this established prior to start of delivery of the project, or is this something that's organically happened over a period of time?
Sorry, Harry, just ask that question again, please.
Sorry, apologies, my work phone started ringing. I was just asking the question of when this evaluation process that you've just highlighted to everyone, when was this actually agreed by yourselves? So was this before the allocation of funding, or was this something that has been established in the last few months?
Yeah, the latter. So this is something that we've been assigned to essentially after the projects have already been funded, which is why we've been kind of negotiating with DFT and the kind of challenges around having such a variety of pilot projects and how we can best evaluate them in a way that's going to be valid and helpful.
Okay, thank you.
Just to add to that, because I know some of you at least will have spoken to us a good few months ago. So we did kick off kind of the evaluation scoping. Was it six months ago now, Kitty? But the first set of activities was really to get up to speed with what each of the pilots were trying to achieve and the sort of data that they would have available. And I know that it was very early days in those first few months in terms of you getting your contract signed, onboarding potentially new staff. So that took a couple of months in itself, having enough information to be able to say, right, what data will we have? What level of involvement? Who are the beneficiaries? What are the right indicators? And then I think from that point onwards, the focus was to come up with the CMD, because we know that you needed to get your monitoring system set up and integrated. So that was the first focus and the most immediate task. And then in terms of the rest of the evaluation approach, which we've explained today, that's really only been agreed with DFT in the last few weeks, actually.
Very much a movable feast, I think. Anybody else there with any queries or questions? Again, if you don't have anything today, as Kitty mentioned there's a query box, or we can relay a query to the teams as well.
I have another question. Sorry, I'm playing devil's advocate a little bit here because I have quite a lot of involvement in social evaluations, things like this. My question is, because obviously the evaluation process that you've outlined has been established quite recently, in terms of the data that you're asking individual pilot schemes to collate, do you think you're actually going to be able to obtain the data that you want to be able to justify the needs of the DFT?
Oh, Iram, are you going to come in on that one?
Yeah, I'm happy to go first. That's a very big question, Harry, and I think if we're being honest, that's why it's taken quite so long to agree the scoping of this evaluation with DFT. So I think they were very upfront that they wanted a counterfactual type approach if possible. They wanted to have this quite rigorous impact data, but just because of the way in which they have selected pilots, the broad range, when you're trying to evaluate a program that has 12 very different interventions, but also within those 12 there may be 3 or 4 sub-pilots, it has been quite difficult to come up with a robust evaluation methodology, and that's why we've had quite a lot of back and forth with DFT to agree that we will do a contribution analysis type approach. We will look very much at the process of how do funds like this work. And there's another element that we haven't actually spoken about, but it's part of our scope. DFT have also asked us to come up with some guidance on how to better set up and evaluate programs of this nature going forwards. And that will include learnings from the scoping exercise. And that will, Harry, include things like potentially bringing in the evaluators prior to selecting projects, because that might help you determine, well, how do pilots need to be set up in the first place, or selected to allow you to have a counterfactual, which minimum data systems are you going to need, which minimum data collection capacities are you going to need, because often it's hard to build that in time, particularly when an evaluation is only going to be a year long. So that's, you know, I think we've done as much as we can to make the evaluation as robust as possible, given the types of pilots that we're working with. But because these are pilots, I think the focus really should be on, well, what are the learnings, and how can that then improve things for future interventions. I don't know if you wanted to add anything to that.
No, just to say I absolutely agree, and I think this is why, you know, it has taken us longer than we would have liked to agree. For example, when we're talking about the process and impact evaluation activities with you today, you know, why we can't tell you which specific pilots we'll be looking at is because we're trying to make sure that the pilots that we choose will give us that best data that we can to kind of really meet DFT's requirements if possible.
Yeah.
Sorry, I have a question. You're asking or saying that you're going to do these focus groups with 6 to 8 of our beneficiaries. The information that we're collecting a lot of the time is anonymised. So how are we going to know who, or how are you going to know who you want to speak to?
Is this for the CMD, Leslie? So when you're filling in the CMD,
it's Colleen, but yeah, sorry.
Colleen, sorry.
Yeah.
On Leslie's teams.
Yeah, so we're doing like the survey sheets, and they're all anonymised.
Mm-hmm.
We've got a massive project going because we're working with many different voluntary sector organisations and individuals and everything.
Mm-hmm.
It's going to be very difficult for us to match up specific questionnaires necessarily with people, and also I can't actually see how we could specifically ask some of our beneficiaries to be involved in this. A lot of them are can't do IT. There are a lot of disabled, elderly, and that kind. So it's I at the moment I can't see how we would be able to be involved in something like that.
And I suppose this is something we could take offline, actually, Colleen, if you send us an email in the DFT loneliness inbox. But I wonder if you know, we are doing these focus groups and recruiting beneficiaries on an opt-in basis.
Okay.
So I suppose it would be that you potentially, whilst filling in the CMD, would ask a beneficiary if they would like to take part in a focus group, and if they say yes, then you could pass their contact details on to us.
Okay.
But yes,
that would work.
Yeah, and if that hasn't helped answer your question fully, then please do drop me an email, and I can we can have a chat offline.
No, that's fine. So I mean, once you know which pilot that you're going to use, if we were to be one of them, that would make my life a lot easier.
Yeah.
So if I could actually speak to them initially, and get their permission to sort of anonymise their survey sheets and that.
Absolutely, and that's what we do have ethical approval for that. So via you know, as an opt-in basis, as you're saying, where you as the pilot lead or staff member would ask if they would be happy for their contact details to be shared with us.
Okay, all right. Thank you.
No worries.
Thanks so much for that.
Just to be clear, so the surveys that you've been completing and uploading onto the system for us, you will never have to match those to a person in your programme. And so
that makes it life a lot easier.
Yeah, you won't. The kind of way we had a conversation internally at CTA at the beginning. Do we want to try and identify those to people? And we kind of felt if we did that, which is why we don't kind of ask you to do the first and second one with exactly the same person, because we knew that would potentially cause significant issues for you in the collation of them and getting them completed. So no, you won't have to link those surveys up to a person.
We made that easier by putting on the numbers with a #1, #2, So each person got given 2 forms because they've got to do at least 2 trips. So at the end of it, so the group, the voluntary sector organisations handed them out, so they know who they've given them to.
Yeah.
And then so I could, when I'm doing, you know, my numbers, I can match one form to do the follow-up form. So when it comes to the secondary forms, I'm doing it for the same person rather than new numbers.
Mm-hmm. It might well be, yes. It's something we do.
Anybody else there with a query or question in and around?
Yeah, I have a quick question. I'm employed by one charity and I'm working in partnership with another. And some of our trips we've been sort of meeting up with the charity that employs me and doing survey form with them. Do I need all their information as well? So basically we're building a client database at the charity that I actually work with. Do I need to bring all that information across from the other charity? Does that mean, am I making sense? I've got, just because we went out for a Christmas dinner and loads of people have done the survey forms, but I don't know if I need to pull all their all their other information, so then not to link them to the survey forms, but as it's really confusing because there's 2 charities involved. I'm doing it under NID Plus. So do NID Plus need all the information for all the people we're surveying, or can they stay at both? Because there's 2 charities involved working together, can they keep their own?
Dawn, do you, so in terms of the data return that you are giving to us, yeah, in terms of, so the monitoring in terms of person, your ID number for that person and what trip they went on, yeah, that data that you're giving us should be the same people that are filling out the surveys.
Yeah.
So yeah, it should be that if person A went on the trip, you're giving us the detail on the monitoring spreadsheet about the trip that they went on and about that person, and then that person should be provided with a survey form.
Yeah.
But what you don't have to do is tell us that that survey was completed by person X.
Right, no, that's fine, yeah. Okay.
Okay, I'm just checking through my list, making sure nobody else has got a query or question. And again, if you need to, by all means, just get in touch with ourselves, or we can pass on, or use the email address that Kitty provided as well. If there isn't any, then what we will do, we will move forward into the next section, which is, I think Caroline's going to jump on and give us some queries and tips. Kitty and Iram, I can't recall, were you staying on for this part of the section, or were you kind of moving on? I just wanted to make sure that we had a chance to thank you, that's all.
Just to say, Iram and Kitty, so I'm going to do a very brief, some top tips, but then I am going to kind of talk through a bit of some of the loneliness results that we've got. So if you were interested in that, you are more than welcome to stay. There is a caveat that we've only got low numbers of our second stage survey at the moment, but I wanted to kind of give people a bit of a kind of feel for where we are with the kind of impact on loneliness data. Just so
no, if you're happy for us to stay, I think we can hang on for a bit.
Wonderful. So without further ado, I will hand over to Caroline then.
So I'm going to do, oh, hang on, I've done the shared screen before I meant to. I'm going to do a little bit of an overview of some really top tips on gathering data, which might be entirely obvious to everybody, but actually just based on the kind of this evaluation from DFT side, where we've already started working effectively before the evaluation was finalised, it kind of shows how you might not always want to do it. So I've got a few slides with just some top tips. What I would say within all of this, I think Mandy, that's coming through yours. We can hear someone else talking. Sorry. You have the little blue line around your box, so I'm assuming that you're the guilty party in that. So when you're thinking about kind of data gathering, the most important thing, or one of the most important things within this, is that you do it right at the start. You don't kind of start delivering and then think, oh, what do we need to start recording? Because potentially you've already missed out on a lot of information. And it might be that you end up not being able to gather data that you potentially might need because you've already started your delivery. So whenever you're thinking about gathering data, try and do it from as early as you possibly can in the process of your project. And these are all very kind of, you know, I'm doing this based on a level of knowledge. So there's not going to be anything super technical in this. We're not researchers. We're just kind of thinking about how can we make sure we've got some good systems and processes in place. So the first thing you want to do is try and define your problem. So be clear what you're trying to achieve or what you're trying to understand. And when you're doing that, you might want to just start listing out lots of questions that you have. So if we think about kind of the tackling loneliness, does it make a diff? You know, a question would be, does it make a difference the type of transport somebody uses? So if it's a car or if it's a minibus, does that make a difference? Does it make a difference the type of activity that person goes to? Does it make a difference how many people are in the vehicle? Is it 3 people? Is it 6 people? You know, so it's ask yourself all those different questions about your project. Then when you've got your big long list of questions, sorry, go back and have a look at them and kind of think about, do we really need to know that? So do I really need to know the impact on men going to the supermarket on a Tuesday in a car? Might be interesting, but do I really need to know that if I think about my data collection? Because all of us have got limitations in our resources in terms of collecting and analysing the data that we get. So be really clear, what is it that you really need to know, and prioritise it. You might also want to consider the end outcome of your data analysis. What are you going to be doing with that? If it's purely just for an internal decision-making process, you might want to ask yourself specific questions in that priority list. If actually what you're trying to do is influence funders with that information, then you might have different questions. So it's think about your end purpose with your data. This is why it's so important to do this right at the beginning. Once you've got your questions, it's then thinking about, okay, what specific information do I need to gather to answer those questions? And really start to kind of list all of those that are in there. You've generally got 2 types of data that you would gather. So your quantitative and qualitative, if you can kind of say it properly. So the quantitative data is the one that we can generally, most of you can pull stats out and throw them at me, the number of passengers that you've got, where you've taken them to, the number of miles that they've done, the amount they paid for their fare, their age of them. So this is all the kind of data that, you know, quite closed questions you can analyse quite quickly, which do tell you something, but actually the qualitative side is the side that enables you to really understand those numbers. So if you were kind of pulling off information that was tracking the number of men that were using your service, and the number of men was dropping over a period of time, you can't really make any, apart from knowing that the demand has dropped, it doesn't give you any reason why. So that's when you would start to look at the qualitative side of, well, why are men not coming? Let's ask them, let's talk to them, let's understand what they feel about that. Could just be that the football season was on and they're not going out as much, they're just watching the telly, or it could be the opposite, the demand's gone up because it's football season, they're going out more. But actually it's kind of wanting to understand the kind of information behind the numbers. It's the side that you will probably spend most time on. It's the hardest to collect, and especially in a lot of charitable services, because it's some of our kind of softer outcomes are quite hard to really pin down. So people focus on a survey that you can kind of fill out quite easily. But again, if you go back to your list of questions, what is it you want to understand? What is it you want to know? What is it you want to answer? You can then start to think about, okay, well, do we need to do some interviews? Do we need to build in some surveys? Do we need to build in some focus groups? And you need to kind of plan it out, which is, again, it's important to do it at the start of your process, because you might think, actually, 6 months in, we need to do a couple of focus groups. But if you're already 4 months into your project, you know, you haven't got any of that baseline information to kind of build your focus group on. So it's always really important to kind of do it as quickly and as early as you can in your process. The other thing that I'd recommend is kind of having milestones to review your data collection. So it's not a start and finish process. It's not, okay, we've identified our questions and we've got this survey, and that survey is going to run for a year, and we're not going to look at any of the data until 9-10 months in, or even at the end of the project, because it could be that something has happened or changed really quickly. So you need to have kind of regular monitoring points in your data review. And you can look at that to kind of go, actually, is it starting to answer the questions that we have? You're not making any judgments. You don't make any judgments apart from, generally, we had a question of X. Is it going to help us answer that question? Yes or no? If it's not, do you need to change that data collection? Do you need to tweak it? Do you need to add in something? So it might be that your data is starting to show you some really unusual trends that you'd not thought about at all, and you're like, well, we need to do more focus groups. We need to build these in earlier to understand our data and our intelligence. Always consider, though, if you change something, that you don't totally invalidate something that you may have been collecting earlier on. It might be that you're 2 months into a project and you're like, we've been asking entirely the wrong questions. So we need to stop what we're doing, reevaluate, and ask an extra set of questions. But it does mean if you're asking a question, even if it's only a couple of words difference in the question, you could totally get different answers, so you can't compare those. So there's no problem with kind of changing partway through your project, but always make sure that you don't then kind of go, okay, well, we can just assume the same thing, even though they're different questions. But it is really important to kind of do that review to make sure that it's still helping you make the decisions that you need, and that if you need to build more into it, you are able to do that. I've got one line on GDPR and data protection and stuff, because this is something that always, you know, have we got permission to do this, that and the other? Obviously, you need to make sure you've got all of the permissions that you need in place. And the thing to kind of always flag and think about is, do I need to collect this information? That's a lot of the kind of focus around GDPR, was around encouraging organisations not to ask questions they don't really need the answer to. For example, do you really need to know the sexual orientation of the people that access your service? Does it help you answer your question? Now, if you were an LGBT charity, absolutely you'd want to ask that question, but generally you probably won't need to ask that question. Unfortunately, central government doesn't always get that memo, so we often have to ask questions that in reality we might question, do we need to have that? But you need to kind of really think about, do we need to ask that question? Do we need to hold that data? Do we have a need for it? Is it going to help us in our decision making? Or are we just collecting it because we think we should collect it and we think we should ask it? And that's where things like GDPR can then, you know, a client can say, well, you don't need to know this about me. Why are you asking it? And obviously within your data collection, you need to make sure you're saving everything securely, and also that people can have access to it if they need to. So in summary, think about this from the beginning. Think about data collection. When you start to think about your project, think about your data collection. Think about, what is it you're wanting to solve? What is your question? What information do you want? What resources, knowledge and skills do you have within your team or your financial resources able? So I know we've mentioned social return on investment. We've got a bit of a social value toolkit. You know, there's you know, you could also engage external evaluators into your project, or actually it might just be, we're keeping this really simple, we're going to have a survey and we're just going to make some decisions based on that. You know, it's thinking about what is your intention, what are you wanting to do, and get that laid out as much as you can in the beginning, so you're asking the right kind of questions, and then think about the tools that you use and consistently go back, monitor and check what actually is happening. Are you, so if you I think it was kind of, I think August, September time, I did a bit of a review on our data in terms of kind of looking at, actually, are people telling us they're lonely? Because if your clients are all filling in the forms telling us as a baseline data that they're not experiencing loneliness, then we're probably not targeting the right clients, because we're not going to see any change in loneliness if none of them are experiencing loneliness. So actually, some of it can just be, are we actually aiming our services at the people that we're intending to aim them to? If one of the things for us in this project was we wanted 70% of our clients to be age 20, we know this quite quickly, this project would have been failing because our client group is in their 60s and 70s. We haven't got that within this project, but by reviewing that data regularly, you'd be able to know, actually, are we not, or are we hitting the right kind of client groups? I've also put a link on there, which I'll put in the chat as well, but if you're on, which hopefully most, if not all of you are, on the, I've called it Tackling Loneliness Hub, but it's not, is it? The Campaign to End Loneliness Hub, is that what it's called? Which I know DFT have got a group on and we've been using, but there's also an evaluation group. Use that as a resource, that hub. There's loads of people on there, there's training, there's information, there's resources. It's, you know, it's not something we've designed, it's something we've kind of tapped into. So there is other stuff on there. And there was a couple of training and information sessions that were run on gathering data, but then also how do you present and kind of use that information. So there's a couple, I put it on the link, there's a couple of good bits in there for people to use. The next bit was going to kind of show you a bit about a little bit on kind of what we've started to, or what we could look at, what we started to look at around the survey data. So this is not the data that you've been completing on the spreadsheets that have gone off to DFT. This is the survey data, which so far is just being held in-house with us. So I just wanted to give you a quick overview, then I'll open for questions, unless anyone's got a burning question on the top tips. Go on, Harry. I knew I was waiting. Go on.
Sorry. No, it's
all right.
I'm going to ask for clarification, really, because you're through that presentation. Thank you, and I'm sure past that, you know, it's useful. But you sort of stipulated within that at the beginning of the process of evaluating, and as you did highlight, you know, through this process, we're already halfway through this project. So I just need to understand something. Are you insinuating that outside of the monitoring forms that you've been asking us to fill from the data that we're collating for our projects, that there is going to be some form of external data that you're going to be wanting at the end of this project? Or is this purely you giving us advice on how we can best utilize the data we're collating for our own use?
Yes. Yes,
Perfect.
We are not, absolutely, but I'm not throwing any more data requirements at you from what you've already got. There is absolutely nothing extra coming, I promise you.
Good. There's sorry,
No,
everyone.
that's okay.
I know I'm asking most questions. I was also really pleased to hear you bring up the question around gender, and also the other part with that, with ethnicity as well, because those are questions which have been asked within the current format that I have anyway for my team to be filling out. And my question around this always is, why are we asking these questions? What is this going to be used for? What is the benefit behind this? So they're questions I've already asked previously, and we'll be asking again as to why we're collating this data.
So when there's for the pilots, you've got two kind of data masters a little bit in this project. You've got from a CTA point of view, what do we want to kind of record as part of our project? And then what is the common data set of which DFT have said this is what you must record? So as has already been mentioned, the common data set hadn't been agreed at the start of the project. And I think we had actually, we'd allocated our projects before we got that final common data set. So we didn't have a list to give to you of this is what DFT is saying. What we were initially going to ask you for was the communities of kind of the communities of interest data, because so within that it would ask, are you a member of the LGBT community? Are you a veteran? That was the extent that we were going to kind of take it down to. But I'm going to blame DFT. Not either of you, Kitty or Imran, but we'll blame DFT because DFT wanted that data, and so from a contractual point of view, we have to ask for it.
Okay, then you, I mean, I know you're aware of where I come from. Sorry again, I don't mean to be dominating with the meeting. I do a lot of work, as you know, probably with the NHS and with other central government bodies. Are you questioning the DFT as to why or what they're going to use the data for? Because if it's going to be used in a productive manner, that's fine. But these questions should be asked.
So they're going to cut. I lovely. I'm glad Kitty took herself off.
I was going to say, do you want me to come in on that one?
Yes, please.
So for us, it's important to understand this. I think from a theoretical perspective, we know that some groups are at higher risk of being lonely, and for us, you know, those groups are ethnic minority groups, LGBT community. Therefore, for us, it's important to have this information because if we can, we would like to do some subgroup analysis to see actually are these marginalised groups at a, you know, does their loneliness, I suppose, improve from these pilots in the same line as everyone else's, or are there groups that are more or less at risk of being lonely? So for us, that's why it's important to have those kind of data points, the sensitive data, if you like.
That would be something very refreshing. There was a mapping exercise with follow-up support from the DFT on the use of that data. That hasn't always been the case in my experience. Anyway, I'll be quiet now. Sorry.
No, but it's an appropriate question, and it's something to ask because I think, you know, we did as a team internally have a conversation. Do we need to know that? And we absolutely needed to know, was there a different impact on different communities? But actually we thought you know, how can we ask? Is there a different way for us to ask that? Do we need to know the individual kind of record? So yeah, it is important because it's easy. I know, you know, I've worked with lots of local authorities in the past and they ask you for everything, including the inside leg measurement, and then they don't do anything with it. And people can get upset when you ask them those questions. So you have to have a valid reason for asking them. So this is what I'm going to caveat now before I present any of this with. This is based on the survey data. Now we had our baseline kind of bit, so that was when we asked you to get people to complete this right at the start of the process, and then the kind of second stage survey. It's so cold in my house. Second stage survey where it was kind of trying to look at, was there a change, was there a movement, what was their scores after they'd had a couple of interventions. The other caveat on this is that obviously because we aren't directly following one person to another, one person throughout the two surveys, our analysis of this will be generalizations because obviously there are individual differences. You know, somebody might not have moved, somebody might have moved, but it will give us, we feel it will give us enough of an indication really to see, has there been an impact on someone's loneliness. For your individual projects, for some of them where you're quite low numbers, obviously the kind of reliability of the data changes a little bit. So I would always recommend for some of you with quite a low number of clients as part of this, that you'd use the overall project data. So we've had 500 and something baselines, but we've only had about 40 odd second stage, which is why my caveat is very much this will change coming forward. So just to indicate some of the bits we're going to do with the data. So one of because obviously you're giving us the postcodes of the clients, we are going to be able to map. These are the survey ones, not the which they should replicate anyway, the other postcodes. But it's a kind of factor. And one of the things we want to do is use this to share with key stakeholders. So, you know, you'll be able to show within your specific regions kind of some of the demographic, not demographics, and the geographic spread, pardon me, of the clients that you are supporting. So this is one of the ways that we will eventually get to kind of some nice graphics. We've got a firm that's going to help us make sure everything's really pretty that you can all use as well, to nice and shiny. Then some examples of, there will be slightly better comparisons bits than these, but just going to give you a few comparisons. So again, when I went back to before about asking questions, so this was off the volunteers. So we asked the volunteers how often did they expect to volunteer, and then we asked how often did you volunteer. Now obviously we've got low numbers on this, but actually we've got a fairly similar spread of what they actually said versus what they've done. When I looked at the other, historically it was kind of things more around ad hoc than a specific number, but once we kind of analyse the data, we'll pull those others out so that everything's included in one of the areas. But so there's a bit of a comparison, you know, so actually when they signed up to you to volunteer, they've ended up doing what they've said they were going to do. We'll see how that trickles through, because this is quite low numbers, the volunteers one. The next questions I'm going to cover are the loneliness ones. So this was off the second survey. So we asked that general question, kind of what impact was it having on your feelings of isolation, loneliness and companionship? They were the 3 areas of the ONS loneliness question. So that's what people are saying. Obviously, these are kind of low numbers at the moment. It's quite interesting when I saw the kind of ones saying very negative. So I think there'd be some interesting kind of follow up on that as to whether someone's ticked the wrong box, because that sometimes happens, or if actually we've had a negative impact on somebody's feelings of isolation and loneliness. But generally we're getting figures that we might hope to see within this. Then these are the ONS questions around tackling loneliness. So how often do you feel you lack companionship? So we can generally see, we will do a point score on this as well, so a kind of a point score as well as a percentage change, but generally we are seeing overall that people are kind of experiencing feelings of lack of companionship less often than they were before. Again, these are super low numbers. I'm going to caveat that with every question. Super low numbers. So it could be that we look at this data in 2 months' time and we've got a totally different trend, you know, because we're not at the end of the programme. So we're not making any judgments off this at this point that the programme is definitely going to impact loneliness. At the moment, it's showing that it might do, but we might get to the end when we've got 500 second surveys. It might tell us something different within it. I hope not, but it might do. Then the question of how often do you feel left out? Again, we've got a similar percentage change where generally people are feeling more connected and less left out. And then how often do you feel isolated from others? So again, we've got a slightly smaller, which is interesting, but a slightly smaller kind of positive change than last time, but again super low. I also did some of this quite late at night, so ignore the kind of bottom percentage line that overmarks itself. And then the main question, so then the kind of main loneliness, so the kind of baseline, 67.8, so roughly 68% of people were experiencing loneliness either occasionally, some of the time, or often. The after survey, that drops to 46%. So we're looking at 21% of reduction in people who are experiencing loneliness either occasionally, some of the time, or often or always. So this is just a kind of, just to give you a bit of a feel that you potentially are making a difference in your, I know you're making a difference, but there's an element that, you know, at the moment, that's what the surveys are telling us. But it's really important that you keep doing those second stage surveys for us, and the first ones, if people are just entering your service now, give us that baseline so we can kind of really feel that we want to make a difference. Our aim is to get to about 700-800 surveys out of the 2,000 clients that the project aims to support. So it will give us a good proportion, a really good percentage of our the number of people benefiting from the service. So these are some other data points that we are going to look at in terms of when we do our main report, in terms of analysing, because we can analyse against all of this because we've got those data points. So are there any gender differences in the before and after scores? Because, you know, we do have a difference in the gender percentage. So we've got lower men at the moment. Does that mean, you know, are men experiencing more loneliness than women? Has there been a bigger change for men versus women in this? We can pull that out. Does age have a factor? So we have got the feedback form, the survey form, which does under 18s. And actually there was a, when I was looking at this last night, there was a slightly lower, they're experiencing like loneliness at a slightly lower percentage than the kind of older age group. So again, we can pull some of that information out. Is one place impacting the score more than others? So when I say place, I kind of mean pilot project. So actually, we will be looking at each pilot project. It could be that one of you is skewing the figures because you've got loads of people that are saying they feel super, super lonely. So we're going to be able to kind of look at each of the individual 18 pilots. We can look at, is the activity people are accessing having a difference in outcome? So if, you know, we've got quite a high proportion of day trips, but there are other activities going on. So do we have a difference in those? We can compare it to the number of times that people are accessing the service, because we've got that from your survey data, and from your, we've got it from the survey data because we do ask people how often they access community transport, but we can also compare that to the data that you're providing in your Excel spreadsheet as well. And also, does the amount of volunteering undertaken have a difference in outcome? And the other thing we'd be looking at as well, which I did in the last month, was looked at the, so in those stats that we had around loneliness, volunteers weren't experiencing loneliness. I think for some of those that kind of came to some of the other sessions, and we talked about actually the fact that it's harder to engage people who are currently experiencing loneliness in volunteering. So often our volunteers aren't experiencing as higher levels of volunteering. And that would be something that we can highlight within this report. So we can still say, actually, there was a difference. People did feel more connected. They did feel less lonely. So if we were able to run a project that was really had the capability to to kind of interact and engage those people, we would have an even bigger impact on a client group. So there's some of the other data points we're looking at. These are just some quotes that I pulled off from the surveys, the second stage surveys. So we'll be interlinking some of the quotes and some of the case studies that you've been sending through in terms of the slight difference that CT has been making. And then this is what we plan to produce. So I had hoped to kind of have a bit of the interim data structured, and Nikki's been doing some bits, but I just haven't had time to do the pretty bit yet. So we have started to kind of promote some of the statistical data out through our social media. And that's something we're going to be continuing to do to try and show the impact and the breadth and the range of the project. We're going to be doing a little bit of an interim data update in towards late January, after you've sent us in the next data return, and we'll kind of produce that up and be able to circulate it round just to give a bit of an indication, and you can then use it as well in your conversations locally. Overall, we will be doing an overall project report for the whole project. So that will be that kind of overall analysis of the data and the impact of the project. We'll be including case studies. The other thing we're looking at within our project is there is the social value toolkit, which is kind of specifically aimed at CT. So while the data we're getting from yourselves as organisations, there's not enough for us to run it on a project by project basis. We will be able to do something we think we'll be able to do something as a project overall, to kind of show some of that, the social value. We are going to be producing or working with you to produce individual project reports. We're only expecting these to be a couple of sides of A4, which kind of show your particular project. So what you did, pulling together all of your data, everything you provided to us, all of your data, all of your stats, will be pulling that in to kind of show what your project did, kind of pulling together the case studies, all of that. So you've got something that shows the impact that your project had. So you don't need to kind of produce that yourselves. We're going to do that. So because we were very conscious you're giving us lots of information on what is going to happen with this. So we wanted to try and give you something back from that. And the other thing we are still considering, which I'd quite like to do, but I am considering it, is producing some regional reports which potentially link to regional data. So we know, for example, Transport for North, the subnational transport body Transport for North, has a specific focus at the moment around social isolation and loneliness. And so actually we might be producing things on a regional basis to kind of say, this could be the impact on your population if you funded CT services because they impact loneliness. So, you know, we very much want to try and use the information to kind of promote CT and support investment where it needs to be. And that is the end. That was my last